Hi, Stuart Carter here, co-owner of Newmarket Massage Therapy Clinic. I'm a registered massage therapist. I'm a manual osteopath. I have my diploma of osteopathic manual practice. I'm also a matrix repatterning therapist as well. So I'm here today. I'm going to explain to you what I do. So in a typical therapy session, I'll do a combination of some advanced massage techniques. So back in the early 90s when I started massage therapy school, in the summers I would take courses in craniosacral therapy, myofascial release, visceral manipulation, lymphatic drainage. So pulling all that information together and doing massage for 21 years up till now. Also mixing in osteopathy, European style osteopathy, and matrix repatterning, which is a wonderful technique. And I combine those all together in like a stew. Stew is in Stuart, but stew is in a good mixture. It's healthy, hearty, and full of goodness. So I'm going to mix that all together and do an OsteoStew for you today. So part of what I do is when you come in and go over your health history, then I'm going to do range of motion and some palpation. But I also like to use this machine. This is a matrix pulse scanner. It's an inductively coupled electronic stimulator, or advanced portable PEMF, which is a pulsed electric magnetic field. We used to work for NASA. And so when I turn this unit on, this helps me to assess the body to find out where any areas that are compromised, whether it's the tissue, the joint, the muscles, the ligaments, it doesn't matter. And I use my other hand to help with this, the coils here. When I put it in this configuration, it has a range about that big, and so what happens is I can use this to assess the body along with tissue tension or tone. What I'll do is get a benchmark. I'll push in with my hand until I hit a benchmark, and once I turn this unit on and scan over the body, I can do it fairly quickly. When I get to a compromised area, like let's say it was in the knee, which softened, this would soften in my hand about 1 millimeter or so, then I would know there's some sort of trauma or block here in this area. And then I would just have to figure out what vector it is, or what axis of trauma. Is it front to back, side to side, or top to bottom? Which would be an indication. If it's side to side, it's X. If it's front to back, it's Z. And if it's top to bottom, it's Y axis. And those are traumas in the area. Mostly working with and assessing the connective tissue, or the collagen, throughout the body, the tensegrity matrix. What happens is it's a crystalline formation in the collagen, and when that becomes compromised due to injury or inflammation, you get bonds or adhesions or restrictions that happen. When I assess that this area needs to be treated, all I do is come in with a slight hand pressure, which they call containment, which is causing a piezoelectric effect. Piezo is pressure, and electric is the charge that happens. So as I contain an area, you get a compression of the collagen, you get an unfolding or releasing of the adhesions, the collagen fibers break apart, it causes electrical charge, which brings in ground substance or interstitial fluid, brings in nutrients to that area so a healing process can happen. And then as I scan through the body and I treat the area, I do the containment, which is a technique. It's very light like this, just very specific in nature. Then I can go back and scan it, and that area will then be clear. It will no longer soften, which indicates to me that I've kickstarted a healing process. So I can do that throughout your body. I might find 5 spots, 10 spots, 20 spots throughout your body. And I can do that with any bone, any joint, any muscle, even organs, liver, the stomach, and whatnot. So it's a beautiful combination. I work from the head to the bottom of the feet to the top of the head. Typical session is about 45 minutes. Depending on how many spots I find, your overall health, you may have to come in 3 times, 4 times, 5 times, sort of just depends. And we can go over that as we work with you. Yeah, the sessions have been very successful and works great in cooperation with massage. I don't do massage, but we have other people do massage here as well as laser. So putting it all together is really therapeutic. So I hope that you learned a little bit of what I do today. We'll call that again the OsteoStew, the mixture of goodness there. And hopefully you enjoyed this video and you know what to expect when you come in to see me. Thank you very much.